Be me, 42, senior security engineer at healthcare system. Making $155,000, been here 9 years, protecting patient data. Organization called Health First Regional, 8 hospital network. Serves 500,000 plus patients across tri-state area. Electronic health records, imaging, lab results, everything digital. My job, keep patient data secure from hackers. HIPAA violations cost hospitals millions in fines. Data breaches destroy patient trust, ruin lives. February 2025, Health First hires new head of security named Victoria. Age 38, came from tech startup, human-centered security philosophy. First security team meeting, she announces her vision. Security needs to be accessible, not intimidating. Too many barriers prevent people from doing their jobs. I'm sitting there thinking, barriers prevent hackers from stealing data. That's literally the point of cybersecurity. About to watch 500,000 patient records get stolen. Because head of security thought firewalls were oppressive. Let me show you exactly how disabling security destroyed lives. February 2025, Health First Security before Victoria. Security team, 12 people, all cybersecurity professionals. 10 men, 2 women, all with security certifications. I'm senior security engineer, CSSP certified, 14 years experience. Manage network security, firewalls, intrusion detection. Report to head of security, protect patient data. My team. Kevin, age 44, network security engineer, 13 years. Manages firewalls, VPN, network segmentation. Marcus, age 41, security operations analyst, 11 years. Monitors security alerts, investigates incidents. David, age 40, penetration tester, 10 years. Tests our defenses, finds vulnerabilities before hackers do. James, age 38, identity and access manager, 9 years. Controls who can access what systems. Tom, age 39, compliance specialist, 12 years. Ensures HIPAA compliance, manages audits. Robert, age 43, threat intelligence analyst, 15 years. Tracks hacking groups, identifies emerging threats. 2 women on team. Sarah, age 33, security analyst, 5 years. Analyzes security logs, investigates anomalies. Jennifer, age 35, security awareness trainer, 6 years. Trained staff on phishing, password security. This team kept Health First secure for 6 years. 0 successful breaches, 0 HIPAA violations. Multiple attempted attacks, all blocked by our defenses. Firewalls, intrusion detection, encryption, access controls. Layered security approach, industry best practice. Healthcare is prime target for hackers. Patient records worth $250 each on dark web. 500,000 patients equals $125 million value to criminals. Medical records contain everything. Social security numbers, addresses, birth dates. Diagnoses, medications, test results. HIV status, mental health treatment, addiction history. Sensitive information used for blackmail, identity theft. We protect this data like it's gold. Because to hackers, it is. Our firewall configuration is sophisticated. Multiple layers, strict rules, blocks malicious traffic. Only authorized connections allowed. Everything else denied by default. Deny by default is fundamental security principle. Block everything except what's explicitly permitted. Sounds restrictive, but it's necessary. Hackers constantly probing for openings. One misconfigured rule, they're in. Victoria's first week, she reviews our security architecture. Sits with me, I walk her through firewall rules. Show her how we segment network. Patient data network isolated from general network. Electronic health records in separate VLAN. Can only access from authorized workstations. She seems confused by the complexity. Why so many rules seems overly complicated. I explain. Each rule serves specific purpose, blocks different attack vectors. Healthcare networks are complex, need granular controls. Victoria, but it makes IT's job harder. Nurses complain they can't access systems remotely. I explain the trade-off. Remote access is risk. We allow it through VPN with two-factor authentication. That's industry standard for healthcare. Victoria, seems like security theater, creating appearance of security without real benefit. I push back. This isn't theater. These controls are effective. We've blocked 47 breach attempts in last year alone, including 3 ransomware attacks. Victoria makes notes, dismisses my concerns. Late February, Victoria starts questioning our policies. Calls department meeting, all security staff. I've been reviewing our security posture. I believe we're oversecured to the point of dysfunction. Kevin asks, what does that mean? Victoria, we have too many restrictive rules, creating barriers that impede legitimate work. David, our penetration tester, asks obvious question. Which rules specifically do you think are excessive? Victoria, firewall rules blocking inbound connections. VPN requirement for remote access. Two-factor authentication for all systems. Room goes silent. Everyone processing this. These are fundamental security controls. Not optional, not excessive, absolutely necessary. I speak up. Those controls protect patient data. Without them, we're exposed to attacks. Victoria, I disagree. I think they create false sense of security, while making staff feel surveilled and restricted. Marcus, security operations, is direct. Ma'am, with respect, these aren't optional. HIPAA requires technical safeguards. Firewalls and access controls are specifically mandated. Victoria, HIPAA provides framework, not specific requirements. We have flexibility in implementation. Tom, our compliance specialist, corrects her. Actually, HIPAA security rule is quite specific. Requires firewalls, encryption, access controls. We're audited annually. Can't just remove controls. Victoria gets defensive. I'm not suggesting removing all controls, just making them more user-friendly. Robert, threat intelligence, adds context. We're currently tracking Russian hacking group, specifically targeting healthcare organizations. They exploit any opening in firewall rules. Now is worst possible time to reduce security. Victoria, fear-based security doesn't serve our mission. Meeting ends with team deeply concerned. Early March, Victoria announces pilot program. Security Accessibility Initiative, going to streamline security controls. Make systems more welcoming to all users. First change, modify firewall rules. She wants to allow inbound connections from broader IP ranges, so staff can access systems from home, without VPN requirement. I object immediately. That's massive security risk. VPN encrypts traffic, authenticates users. Direct inbound access bypasses all that. Victoria, VPN is intimidating for non-technical staff, especially women who may feel less confident with technology. I'm stunned by this reasoning. Security controls aren't gendered. VPN protects everyone's data equally. Victoria, but perception matters. When security feels like obstacle course, it discourages participation from underrepresented groups. Kevin tries different approach. What if we improve VPN training? Make it easier to use, better documentation. Victoria, training still creates barrier. I want frictionless access. David asks the critical question. If we allow direct inbound access, how do we prevent unauthorized access? Victoria will use IP whitelisting. Only allow connections from residential ISPs. David explains the flaw. Hackers use residential ISPs. They compromise home routers, use them as launching points for attacks. IP whitelisting alone isn't sufficient. Victoria will monitor for suspicious activity. David, after they're already inside the network. That's reactive, not preventive. Victoria, decision is made, implementing next week. March 10th, Firewall changes go live. Kevin forced to implement Victoria's rules against his professional judgment. Opens inbound access to EHR system from any residential ISP in our region. Removes requirement for VPN. Just username and password authentication. No two-factor, no encryption. Patient data accessible from open internet. I document my objection in email. Send to Victoria, CIO, Compliance Officer. New firewall rules violate security best practices. Create unacceptable risk to patient data. Strongly recommend immediate reversal. Victoria responds. Objection noted and rejected. Have confidence in new approach. CIO doesn't respond. Probably didn't read it. March 12th, 2 days after changes. Robert, Threat Intelligence, sees concerning activity. Dark web forum discussing health first. Russian hacking group called MedSteel, known for targeting healthcare organizations. They're sharing information about our network. Someone posted our IP ranges. Posted details about our firewall configuration. Robert brings this to Victoria immediately. We're being actively targeted. Hackers have reconnaissance on our network. Need to lock down firewall immediately. Victoria. Dark web chatter doesn't mean imminent attack. We have monitoring in place. Robert. Monitoring detects attacks after they start. Firewall prevents them from starting. Victoria. I'm not reverting the changes. Give it time to prove itself. March 14th. Marcus in Security Operations sees alerts. Unusual login attempts to EHR system. From IP addresses in Russia, China, North Korea. Hundreds of attempts per hour. Automated brute force attack. Trying username, password combinations. Our old firewall rules would have blocked this. New rules allow the attempts through. Marcus escalates to Victoria. Active brute force attack against patient records. Need to block these source IPs immediately. Victoria, how many successful logins? Marcus, none yet, but it's only matter of time. They're trying millions of combinations. Victoria, then current controls are working. Alert me if they actually get in. Marcus comes to me frustrated. She doesn't understand how attacks work. By the time they get in, it's too late. I agree, but we're powerless. Victoria has authority. We don't. March 15th, 3 a.m., my phone rings. Marcus, panicking. They're in. Breach detected. Active data exfiltration. I'm out of bed getting dressed. What's the scope? Marcus. EHR database. Looks like full access. They're downloading patient records. I'm driving to office 20 minutes away. Shut down external access immediately. Marcus, already tried. Victoria's approval required. Can't modify firewall without her sign-off. I call Victoria, no answer. Call again, voicemail. Text her, emergency, active breach. No response, she's asleep. 3:25 a.m. I arrive at Security Operations Center. Marcus shows me the logs. Attackers got in through compromised home router. Residential IP address in our whitelist. Used stolen credentials from phishing attack. Once inside, they escalated privileges. Now have full database access. Downloading everything. Names, addresses, social security numbers. Diagnoses, medications, test results. Everything on 500,000 plus patients. I make executive decision. Cut external access now. Marcus, Victoria will be furious. I don't care. Do it. I'll take responsibility. Kevin shuts down the inbound rules. Closes the hole, but damage is done. Attackers already downloaded 380 gigabytes of data. That's approximately 520,000 patient records. Complete medical histories, everything. 3:45 a.m., Victoria finally calls back. Angry. Why did you shut down external access? Without my approval. I explain, active breach, patient data being stolen. Had to stop the exfiltration. Victoria, you overstepped your authority. I'm angry now. You created this breach. I warned you. We all warned you. Now 500,000 patients are compromised. Victoria, we don't know that yet. I sent her the logs. Yes, we do. It's right here. 520,000 patient records downloaded. Full medical histories, SSNs, everything. She goes silent, reality sinking in. 4 a.m. Victoria arrives at office. Sees the evidence, can't deny it. Calls CIO, wakes him up. Explains there's been security incident. CIO arrives by 5 a.m. We brief him on full scope. 520,000 patients compromised. Complete medical records stolen. Attackers are Russian cybercriminal group, known for selling medical data on dark web. CIO asked the obvious question. How did they get in? I explained. Through firewall changes. Victoria opened inbound access without VPN. Attackers exploited that within 4 days. CIO looks at Victoria. You changed firewall rules. Victoria, I was improving accessibility. CIO, you created massive data breach. Victoria tries to deflect. Security team should have detected earlier. I show him my email. I objected in writing. Warned this would happen. Was overruled by Victoria. CIO reads it. Timestamp shows March 9th. 1 day before firewall changes. I predicted this exact scenario. 5:30 a.m. CEO arrives. We brief her on breach. 500,000 patients compromised. Medical records on dark web within hours. CEO asks about HIPAA notification requirements. Tom, compliance, explains. 60-day deadline. Must notify all affected patients. Must notify HHS Office of Civil Rights. Must notify media if over 500 people. CEO, this will be national news. Tom, yes, largest healthcare breach this year. CEO asks about penalties. Tom, HIPAA fines up to $50,000 per violation. 520,000 patients could be $26 billion maximum. Realistically, probably $50 to $200 million. CEO goes pale. That could bankrupt organization. She asks Victoria directly. Why did you change Firewall? Victoria, to make security more accessible. CEO, accessible to who? Hackers? Victoria, to staff who felt intimidated by security measures. CEO, which staff complained. Victoria, it's about perception, not specific complaints. CEO, you changed critical security controls based on your perception without consulting security professionals. And now, 500,000 patients are compromised. Victoria has no good answer. March 15th, 9 a.m., breach response begins. Hired cybersecurity forensics firm. They analyze attack, confirm scope. 520,000 patient records stolen. Attackers are MedSteel Group, based in Russia. Same group Robert warned about. Forensics firm finds their mistakes. Left traces in system logs. Can track where data went. Dark web marketplace called MedData Exchange. Records posted for sale within 12 hours of theft. $250 per complete medical record. Total value, $130 million. By noon, records are being sold. We can see them listed on dark web. Names we recognize, our patients. Complete medical histories for sale to criminals. March 16th, notification process begins. Must send letters to all 520,000 patients, explaining their data was stolen. Offering credit monitoring, identity theft protection. Cost, $12 million just for notification and monitoring. March 18th, media gets the story. Health First breach exposes 500,000 patient records. National news, every outlet covers it. Patients calling in panic, asking what was stolen, what they should do. Call center overwhelmed, can't handle volume. March 20th, first patient harm reported. Woman, age 34, HIV positive. Medical record showed her diagnosis. Records sold to blackmailers. They contact her. Pay $50,000 or we tell your employer. She's not out at work about her status. Fears discrimination if disclosed. She pays the blackmail. This is what medical data theft enables. Not just identity theft, but targeted extortion. Using most sensitive personal information. March 25th, more patient harm emerges. Man, age 42, addiction treatment history. Record showed opioid addiction, 3 years recovery. Blackmailers threatened to tell his family. He's kept recovery private. Family doesn't know. Demands $30,000 to keep quiet. He can't pay. They send the records to his wife. Marriage ends. Family destroyed. Woman, age 28, mental health treatment. Record showed suicide attempts, psychiatric hospitalization. Information sent to her employer. She's fired. Employer claims reliability concerns. Discrimination lawsuit filed, but damage done. Another woman, age 51, abortion at age 19. Kept private for 32 years. Blackmailers threatened to tell her adult children. Religious family. This would devastate relationships. She pays $40,000 from retirement savings. These aren't hypothetical harms. These are real patients, real lives destroyed by data breach that was completely preventable. April 1st, HHS Office of Civil Rights opens investigation. Federal agency that enforces HIPAA. Reviewing our security practices. Reviewing how breach occurred. Interviewing security staff. I provide all my documentation. Emails warning about firewall changes. Objections that were ignored. Timeline showing breach happened 4 days after changes. OCR investigator reads everything. You've documented extensive objections. Predicted this exact attack vector. Why did head of security override you? I explain. She believed security controls were barriers. Wanted to make systems more accessible. Investigator. Accessible to attackers, apparently. April 10th. First patient suicide. Man, age 38, medical record exposed. History of sexual abuse as child. Kept private his entire adult life. Record sold. Information sent to his family. Extended family learns details of his trauma. He can't handle the exposure, the shame. Leaves suicide note. My private pain was stolen. Now everyone knows I can't live with that. Found dead from overdose. Security breach didn't just expose data. It killed him. I read the news report, can't stop crying. His blood is on our hands. On Victoria's hands specifically. She disabled the firewall that would have protected him. April 15th, second patient suicide. Woman, age 29, severe mental illness. Record detailed her diagnoses, medications, hospitalizations. Information shared with her professional network. Colleagues found out about her psychiatric history. Lost her job, lost her reputation. Suicide note mentions the breach specifically. My medical privacy was my lifeline. Without it, I have no future. 2 deaths directly linked to data breach. Not hypothetical, not exaggeration. Real people who killed themselves because their medical secrets were exposed. April 18th, Victoria is fired for cause. Escorted from building by security. She posts nothing on LinkedIn. Her attorney advised silence. Criminal investigation is possible. April 20th, class action lawsuit filed. 520,000 patients are class members. Seeking damages for privacy violation. Medical identity theft, emotional distress. Wrongful death claims for 2 suicides. Lawsuit estimates $500 million in total damages. May 2025, OCR issues findings. Office of Civil Rights completes investigation. Health First failed to implement adequate safeguards. Head of Security removed critical firewall protections, despite written objections from security professionals. Breach was direct result of those changes. Penalty, $127 million HIPAA fine. Largest healthcare privacy fine in history. More than Anthem breach, more than Premera. Record-breaking penalty for record-breaking negligence. May 15th, criminal charges filed. District Attorney charges Victoria. 520,000 counts of unauthorized disclosure. 2 counts of manslaughter. Criminal negligence causing death. Federal charges also filed. Computer fraud, identity theft facilitation. She faces up to 25 years if convicted. June 2025, Health First facing bankruptcy. $127 million OCR fine. $500 million class action lawsuit. $50 million in breach response costs. Can't survive financially. Begins merger talks with larger health system. Will lose independence. Absorbed into competitor. 700 jobs will be eliminated in merger. I'm one of them, security team being eliminated. Acquiring system has their own security staff. July 2025, Victoria's trial begins. Prosecution presents timeline. Shows firewall changes, security objections. Shows breach happened 4 days later. Shows 520,000 patient records stolen. Shows 2 suicides linked to exposure. Defense argues Victoria made judgment call. Intended to improve accessibility. Didn't intend to cause harm. Prosecution shows emails where security team warned. Specific warnings about Russian hacking groups. Specific warnings about brute force attacks. All ignored by Victoria. Prosecutor. Ignoring expert warnings isn't judgment. It's negligence, criminal negligence. July 20th, jury convicts on multiple counts. Guilty of criminal negligence. Guilty of unauthorized disclosure. Guilty of 2 counts manslaughter. Sentencing, 12 years federal prison, plus $250,000 fine, plus permanent ban from IT security work. Judge at sentencing. You were entrusted with protecting most sensitive personal data, medical records, psychiatric histories, private diagnoses. You removed protections despite expert warnings. 2 people are dead because of your negligence. Hundreds of thousands more had their privacy destroyed. 12 years is lenient given the magnitude. August 2025, I'm unemployed in therapy. PTSD from the breach, from the deaths. Keep thinking about that man. Age 38. Childhood abuse survivor. His private trauma exposed, driven to suicide. If Victoria had listened to warnings, if she'd kept firewall protections in place, he'd be alive today. Therapist says I did everything right. Documented objections, warned leadership, was overruled by someone with authority. But doesn't change that he's dead. Doesn't change that I was part of system that failed him. September 2025, I take new job. Security director at different healthcare system. $175,000. They specifically want someone who understands healthcare security risks, who won't compromise on patient protection. My first policy: security controls are non-negotiable. Firewalls stay configured properly. VPN required for all remote access. 2-factor authentication mandatory. Anyone who objects can escalate to me, and I'll explain why answer is no. Based on expertise, not ideology. Based on patient safety, not accessibility perceptions. Now it's today, October 2025. 8 months since the breach. 7 months since first suicide. Health First no longer exists, absorbed in merger. Victoria is in federal prison. Serving 12 years for criminal negligence. 520,000 patients still dealing with consequences. Medical identity theft ongoing. Credit fraud, tax fraud, all using stolen data. Some still being blackmailed years later. 2 families mourn their loved ones. Man age 38 couldn't survive exposure of childhood trauma. Woman age 29 couldn't rebuild after professional destruction. Both deaths directly linked to data breach. Data breach directly linked to firewall changes. Firewall changes directly linked to Victoria's ideology. She thought security controls were barriers, intimidating obstacles to accessibility. She was catastrophically wrong. Security controls are protections. Firewalls protect patient privacy. VPNs protect medical data. Authentication protects sensitive diagnoses. When you remove those protections because you think they're inconvenient or intimidating or not inclusive enough, hackers get in, patient data gets stolen, lives get destroyed, people die by suicide because their private medical secrets were exposed to the world. That's not accessibility. That's negligence, criminal negligence. That got her 12 years in prison and killed 2 people who trusted us to protect their data, and we failed them because head of security disabled a firewall and 500,000 patient records were exposed to criminals